Health.
Did you know that men and women between the ages of 34 and 50 years old account for 44% of all cosmetic procedures? Mommy Makeover is becoming the #1 reason for combining surgical breast and tummy surgery in a single operative session. Hi, I'm Dr. Paul Vanek, a board-certified plastic surgeon, and I'm here to help you think health. Cleveland area mothers devote so much of themselves and their resources to their children, from time and energy to money and miles in the car. You feel good about it, knowing that every sacrifice is more than worthwhile to keep your family healthy and happy. But even with all you do, what gets a little lost is your own well-being. What if you could take care of yourself and your family too? That's exactly the philosophy behind the Mommy Makeover. Now more than ever, you have exciting surgical options to reverse the unwanted effects of childbearing and age. So how do I decide what I need, you may ask? Here's the basic rule. If you have excess fat in your abdomen in addition to excess skin and sagging muscles, then an abdominoplasty would probably give you the best results. If your main concern is excess abdominal fat, then you're probably a candidate for Vaser liposuction alone. Liposuction with Vaser will selectively remove excess fat deposits, but it may not cause all the excess skin to shrink down. If you have excess skin already, it could appear even more loose and sagging after liposuction. With an abdominoplasty, this wouldn't be a problem because excess skin would be removed along with excess fat. In addition, an abdominoplasty will repair weakened abdominal muscles for a slimmer and tighter figure. Of course, depending on your shape, you can safely combine a tummy tuck with Vaser liposuction. A lipoabdominoplasty is a technique that removes excess skin and thins the abdominal wall layer. This surround sound Vaser treatment uses ultrasound energy to liquefy the fat cells selectively on the back, abdomen, flanks, and around the breast areas. Here's a 48-year-old from Aurora that had twins, then another pregnancy. She combined a tummy tuck with Vaser of her abdomen, flanks, arms, and axillary area to get to the next level. This 39-year-old had breastfeeding changes and then wanted her breasts restored to their former shape and size with a breast augmentation and lift, which I did 5 years ago. She came back and had a tummy tuck and Vaser abdomen, and here are her results 3 months later. This 41-year-old was working nights and was suffering from a lot of knee pain and had back surgery because of her weight problem. She wanted to undergo a breast reduction at the same time as having her tummy and body shape improved with Vaser treatment. Because of the selective gentle Vaser, I'm able to perform significant reduction in each area and still get her back to work in about 10 or 12 days after surgery. This 42-year-old Cleveland businesswoman and mother wanted a Brazilian buttock lift where the fat cells and stem cells are harvested from the abdomen and flank area and then transferred as a permanent graft to enhance the buttock volume and irregular contours. Seen here, she has a flatter tummy from the Vaser and abdominoplasty and will have years of happiness with the way her jeans fit in all dimensions. I'm here with a beautiful Erie mother, Laura Russo. Thank you, Laura. I'm so pleased you can join me on Think Health.
Thank you, Dr. Vanek.
You worked really hard to get your body back in shape after childbirth. Would you tell our audience how you decided to have a breast augmentation and a lift, and then a tummy tuck later?
Well, it was something I had thought about for quite a while, and after having my kids, and then I decided, you know, for me, I wanted to do it to get some confidence, and I had support from my family. And then my issues were, though, you know, what would people think about what I was doing and work downtime, and then finding the correct surgeon.
Well, you returned quickly to regular activities after your tummy tuck. How do you feel about your results overall now?
I'm extremely ecstatic about them, exceeded my expectations, and I'm looking forward to going on vacation in the spring.
Well, individual results, of course, may vary when discussing your options. With me, you'll review the concepts of combining procedures for a single anesthesia, a single recovery, one period of downtime, and the kind of time off you should plan for given your individual schedule. If you're ready to learn more about Mommy Makeover, call my office or click over to my website at paulvanekmd.com to see more before and after photos. Until then, thanks for letting me help you think health.
Think Health.